why do operators, or why are you guys using an angled pig or like a balloon-assisted catheter to get up? Just to let some of, like if you don't do a lot of these, you're not in the pulmonary arteries very often.
Yeah, I mean,
down.
I just find that, especially in the patients who have larger RVs, I feel like the angled pig it's just anatomically, it's more suited to just track up the RVOT into the PA. And balloon tips, I mean, if you're familiar with floating swans, I mean, it's just the easiest to have a balloon tip catheter. It just seems to track a little bit more easily up there.
Okay. So Zarina, with you, once you have your Rosen in, will the 24 French catheter track over that, or do you exchange out for the Amplats?
This is a good question. I've tried both ways and kicked myself a few times in the case when I use a Rosen. But generally, I honestly sort of gauge by the patient's body habitus and how easy it was to track my equipment up there in the first place. So if I find that it's a larger patient or the RV is huge and I'm going to need support, I'll just switch out to Amplats instead of the Rosen. But I have done cases where I just upsize over the Rosen and it's fine.
I just wanted to add something to what Zarina said in terms of, the pigtail versus a swan catheter. For people who haven't done these catheters, the key and the reason to utilize these catheters is if you accidentally get behind the chordate, you're taking a 24 French device up there, you're going to tear it and you're going to have a problem. So yeah, while you could get away with it with, smaller profile devices, that's really critical to somebody who's never done this procedure. And I've had cases, like Zarina described, where you have a really blown out heart and your heart have a hard time getting anything up there. And I sometimes just utilize like a MPA catheter or some type of angled catheter to get up there. But before I start advancing a device there, I will always run a balloon over that wire. And I want to make sure that thing is flowing, completely smoothly without any interruption. It should smoothly go up, smoothly come back. And then you're not behind a valve. Otherwise, you're going to end up with major complications.
Right. And so, Ripal, so if you end up like in between a chordae or like you catch a valve and like you run that balloon up, like what size balloon are you using? Like any real like examples of what you like off the shelf? Like is a Fogarty big enough or do you need like a Python? Or
Yeah, just a 035 over the wire Fogarty works perfectly fine. Or the Swan that we utilize, the Arrow Swan. You could just run, the Arrow Swan has an 035 lumen to it. So you could just run that right over your wire as well.
Okay. Ripal, you also mentioned that during the workup, all your patients get an EKG, and you specifically mentioned left bundle branch block. Can you just like dumb it down, like why this in particular you're worried about?
Yeah, sure. I think, sometimes, when you're caught in the excitement of, or, a sick patient, it's easy to forget some of the most important critical things, when you're doing one of these procedures. This is something you don't want to miss. Because if you have a left bundle branch block and just crossing the right heart, you can induce a right bundle branch block and the patient will go into total heart block. And the last thing you want to be dealing with, especially if it's in the middle of the night, is, a patient with a complete heart block who's already sick. So again, look, if you already know it in advance, you could plan for it and, get a pacemaker, etc. But if you missed that to begin with, you could run into major issues. And I think, Zarina can probably speak on this, in much more detail as a cardiologist, but it's something that I don't want to be dealing with in the middle of the night.
Sure. All right. So one of the things that I wanted to talk about is just best practices. Like you both of you start on the right. Any reason you start on the right, or is that just where the 24 French finds itself? Zarina, start with you.
I think kind of as Dr. Gandhi was talking about earlier, like it's basically, I start on the right because I find after you do that, it's just easy to swing over to the left and get onto that side. Yeah.
Okay. And as far as like you guys both mentioned using the T20 catheter and the curve of that, so what you do is while you're in the right, you have the T20 up and you just pull back and twist and it'll just fall into the left. Okay.